Good morning. Please, if you can hear me, respond, please.
Good morning, sir.
Good morning, sir.
Can you hear me clearly?
Yes, sir.
All right. All right, you're welcome to today's lecture. We are still on the course, Action and Uses of Medicines, AUM 221. And today we'll take a look at antiseptics and disinfectants. Today, we take a look at antiseptics and disinfectants. So this is the last topic on this course, and it's not going to take us time, just a few minutes we are done. We're not spending much time on this topic. Few minutes we are done. So without wasting time, the antiseptics and disinfectants are under a class of agents known as germicides. Germicides, from the name germicide, germicides. Germ from side. So it talks about what? Killing. Side. Of course, we know what germs are, so germs are not new term for us. So the germicides are chemicals that are used to kill, even though yes, some inhibits. So you can broadly say that they are chemicals that are used to kill or inhibit the growth of microorganisms. When we say microorganisms, we are talking about things like bacteria, viruses, fungi, protozoa. But on contact is not the one you take inside and you go and start entering your system and start looking for. No. Based on what? On contact. So let's look at antiseptics. Let's look at antiseptics. So what are antiseptics? What are antiseptics? If you're not careful, you will think that they are the same thing. Yes, both of them are germicide, but they are not exactly the same thing. Their difference is mainly based on how they are used and what they are used for. So antiseptics are actually agents that are applied on living tissues, that is skin, mucous membranes, and what have you. So they are to reduce or inhibit what? Microbial growth. So they are used topically. Please, they are not for injection. They are used topically mainly for wound cleansing, dressing, and minor skin infections. Please note that. Then when it comes to disinfectants, these ones are applied on inanimate objects and surfaces. So it's not on living tissues. Please note the difference between the two of them. Not on living tissues. These ones are on what? Inanimate surfaces. That's for what? Disinfectants. So they are used for surfaces like instruments, floors, tables, equipment, and what have you, to eliminate what? Pathogenic what? Microorganisms. Now, it's true that you see that they are used interchangeably, and you may think that they are exactly the same thing. So they're not exactly the same thing. So note that point today. Even if you did not learn anything today, learn that antiseptics and what? Disinfectants are not exactly what? The same thing. What did I say about the differences. I'm listening. What did I say about the difference between the two of them?
Sir, you said for the disinfectant is used in inanimate surfaces. For the
You say what?
disinfectant is used in inanimate surfaces. Inanimate surfaces.
Inanimate.
Surfaces. Why for the antiseptic
I'm listening.
is used in living tissues?
Antiseptics. Okay. Good. Good. Okay. Let's continue. Who is this? Mute your mic, please. Mute your mic, please. Your baby is disturbing. Mute your mic. If you are at home, mute your mic, please. Thank you. All right, so let's continue. So let's look at the properties of an ideal disinfectant and / antiseptics. Properties of an ideal, or simply say properties of an ideal germicide. One is that they should be an ideal germicide should be chemically stable, not changing from one form to the other. Chemically what? Stable. It should be inexpensive, at least. It should be affordable. It should not tear your pocket, because this is what you need on a daily basis, even as an individual, or even in the hospital setting, or where you are working. So it should not be that expensive. Yes. Then it should be readily available. It should be what? Readily available. It should be readily what? Available. Another point is that it should have, at least it should have broad spectrum of antimicrobial activity. You should have a broad spectrum of, because you don't even know the one that on the surface you are killing. You know, this is not where you can start doing culture and sensitivity tests to know the microorganism on the surface. So you can now, you go to lab and culture it, that this is the microorganism. No, it's not the normal treatment you do. Maybe if you go to take, if you want to commence antimicrobial treatment, you can do culture sensitivity, get a specimen, culture it, try sensitivity test to know. No, you don't even know what is on the surface you are cleaning. So because you don't even know what is on the surface you are cleaning, or the exact thing on the wound you are cleaning, so there's need for an ideal disinfectant or antiseptic to have broad spectrum of what activity. In fact, preferably said, it should be cider, not even static. So you should not, but it should not be slowing down the growth, or no, it should be cider. It should kill, because you don't even know how pathogenic that particular microbes is. So it should be preferably cider, and it should have broad spectrum of what activity. Another ideal property of an ideal germicide is that it should be effective against spores. It should be effective against spores, because it's not just about killing the organism. What of the spores? You may kill the organism, but you may not even, the one you're using may not even be able to kill the spores of the organism. So after the spores will germinate and keep growing, keep multiplying. So you should also be effective against the spores of what? The microorganisms. And it should be active in the presence of blood. Yes. The presence of blood should not render it inactive. Because remember, some are used to cleanse wounds. Remember? So you should be active, effective, even in the presence of what? Blood. It should also be effective in the presence of pores. Remember, some wounds already started developing. There are some wounds, some fresh wounds may not have pores, may just have blood and fluid coming out. But there are some pores there are some wounds that already not fresh, they have pores. So if they have pores now, you now use all these antiseptic to cleanse the wound. Because of the pores now, it will now affect the effectiveness of the what? The antiseptics. It should not be like that. So an ideal germicide as antiseptics should be effective even in the presence of what? Pores and other organic matters, debris, pores, debris. So they should be effective against blood, pores, and debris. Wound debris, other organic matters in the wound and what have you, even in other surfaces, not necessarily the wound alone. An ideal germicide should be non-irritant. It should not cause irritation. Very important on the skin or the mucous membrane where it applies. It should be non-allergic. It should be what? Non-allergic. So it should not, it should to the system. All these latecomers. All these latecomers. I don't know what to do to you people. Let's continue. And you are distracting my class. Okay. So it should, at least to some extent, reasonable extent, it should not be staining. Even though some still stain, but it should not be staining. Yes, it should not be staining. And it should not be corrosive. It should not be what? Corrosive. It should be water compatible. It should be what? Water compatible. And ideal germicides should, in fact, the penetration power of an ideal germicide should be top notch. So you should be able to penetrate crevices and organic films. So you should have this, you should penetrate well. So you should be able to penetrate crevices and organic films. So these are some properties that they're not limited to these, but to a reasonable extent. Properties of an ideal germicide: antiseptic, disinfectant. There are many of them, but you're going to look at their mechanism of action together. So if every germicide you point out, you will have one or more of the following mechanism of actions I want to talk about now. So we are talking about the mechanism of actions. The first mechanism of action is by oxidation of the microbial protoplasm. I hope you know what protoplasm is. Protoplasm is what? Who can tell me what protoplasm is? Going back, you did cell in your biology and you did cell in your microbiology, I think so. So tell me, what is protoplasm? If you hear the term protoplasm, what is it talking about? I am listening. Protoplasm, what is it made up of? Tell me what it is first, then, and what is it made up of? Protoplasm. I'm listening. This class is going to be, I want this class to be, thank God you have the course material, so you should study ahead. So I want the course to be interactive, the topic to be animated. Yeah, tell me about protoplasm. So what do you understand by the term protoplasm? I am listening. Hello? Silence everywhere. What's going on here? And tell me, what is protoplasm? Which part of the cell is regarded as a protoplasm, and what? If you keep quiet, if our time elapses, it will go. This is biology, this is not even pharmacy, this is biology. So don't keep quiet, because I won't take that one. If you keep quiet and end our lecture here. You go and read up. Oh yeah, you must answer this one. Anybody that passed biology in
Sir, please come again with the question.
I feel like if I knock your head now,
Sir,
I
I did
knock your
not
head.
hear.
I said, I'm talking about protoplasm. Protoplasm or protoplasm, anyhow you want to pronounce it. So what is protoplasm? What part of the cell is regarded as a protoplasm? What does it contain? What are the components of the protoplasm? That's what I want to hear. Just tell me what you know about protoplasm.
Hello, sir. Protoplasm is the essential living substance within a cell, encompassing everything inside the cell membrane, including the nucleus.
Is somebody didn't charge it for me? Not even for me. I say
No,
it's
sir,
true.
no, sir, no, it's okay, sir. It includes
Are
the
you
nucleus,
newscaster?
cytoplasm, and all organelles.
Wait. Are you a newscaster? You are reading news. I say just tell me what you understand. If you read something now, no. If you are explaining now, no.
Okay,
That as
okay,
now you are reading, don't read anything. Just tell me what you understand by the term.
Sir.
okay.
That's what
Oh.
okay, follow me. Yeah,
So I want to try.
try. We are all trying.
Is like the complex substance within cells compromising maybe cytoplasm and nucleus.
Cytoplasm.
And nucleus, yes, sir.
Even though you try to modify it, but I know you still, but it's okay. It's the component of protoplasm are what? Nucleus and what? Nucleus and what? Cytoplasm. In fact, the protoplasm is the living component of the what? Cell. Simple. That's the living component of the what? Cell. We have the plasma membrane. Plasma membrane and the what is it called? And the cell wall if it is for plants. But for animals, we have just plasma membrane, then the protoplasm. So protoplasm is a living component. The nucleus and what cytoplasm. Of course, the nucleus is the organ that control what happens in the cell. What is cytoplasm now contains all that component, organelles, name them, suspended in the cytoplasm. So this protoplasm is the living component of the cell. So, all right, thank you for that. Let's continue. I just want to be sure that you understand what I'm talking about. So, this, some of these, germicide, the making of action is by oxidizing the microbial protoplasm. You know that these microbes are cells. Some are cells. Apart from the virus, they do what? They attack. They oxidize the microbial cytoplasm. Remember, chemistry is life. Everything is all about chemistry. Since the entire thing about this life is all about chemistry. That's why if you don't know chemistry, you say you're doing science, you're wasting your time. Everything is science. So through oxidation, they will destroy a lot of things in the protoplasm of these microbes. And this is how they can exert their what effect. You see things like halogens like chlorines, and what are they? Halogens, then peroxides. Halogens and peroxides are commonly have this works, make this work for action, oxidizing the microbial protoplasm. Then some exert their effect, by denaturing the protein and enzymes of the what? Microorganism. So we call it denaturation. Denaturation of the world, the proteins of enzymes. You know that enzymes, the protein, they catalyze a lot of biochemical processes going on in the living organism, both these microorganisms. A lot of things going on is under the jurisdiction of these enzymes. So if these enzymes are denatured, that means it will affect the microorganism. They will not be able to do what? They will even die, or they will not be able to do or carry out the activities that they should carry. That thereby decreasing the amount of these organisms in the surface or the body where these germicides are applied. Things like you have things like phenol and phenol derivatives act by what? Denaturing these enzymes and proteins. Other ones like aldehydes, metals, and alcohols. Aldehydes, metals, and alcohol. These are other classes of what? Germicide that denature the protein or the enzymes of these microorganisms. And we have others that disrupt the membrane permeability. They disrupt the membrane permeability of these microorganisms. You see things like detergents and other quaternary ammonium compounds. Quaternary ammonium compounds. So I want to just look at the major classes, then say one or two things about them. Then that will be all. We are not taking much. Based on the curriculum, we are not going deeper into all this, into this. But if you can do more research and deepen your knowledge, in them. So let me just go straight to the major classes and some points you need to note in these classes. Now, the first class I want us to look at are the phenol and its derivatives. Phenol and its derivatives. Phenol. So let me just simply say phenol derivatives. So it means phenols and some other agents that are created or produced or synthesized from what? Phenol. That's what we mean by phenol and its derivative. Here we have something like phenol, cresol, resorcinol. Like phenol, cresol, resorcinol. Resorcinol. So these are active. Please let me admit the latecomers. I don't know how to stop them from entering the class because they will have a lot to miss if they miss this class. All right, so now, under this now, these ones, they are active bactericidal. They're active bactericidal, virucidal, fungicidal agents. They are bactericidal, virucidal, fungicidal agents. Just at a very few percentage aqueous solution, they are fungicidal, virucidal, and bactericidal. Of course, I've explained what I mean by what cidal. So if you hear fungi, talking about fungi, we have virus, talking about virus. We have bacteria, talking about what? Bacteria. These are the major pathogens that disturbs us, that disturb us. So they denature proteins and what? Disrupt membranes. At high doses, they are systemically toxic and they are corrosive at high dose. So these are the things you should note. So that means that's why you need diluted, not just that high concentration. At high dose, they are systemically toxic and they are what? Corrosive. So please avoid using these phenol derivatives around any pets, any pet, dogs, cats, because they are toxic to them. Just avoid. For those that maybe you want to use them at home for one or maybe surface cleaning. You know that these dogs, they will still go out to all those surface cleaning. The clean surface to do one or two things. So be careful while using this if you have pets at home, because they are toxic to them. They must don't even know what it is. So from the application and how you use them and how you keep them, be careful. So the second class I want to talk about is oxidizing agents. Oxidizing agents. Oxidizing agents. Oxidizing agents. So under this oxidizing agent, that's where you have your what? Hydrogen peroxide and your potassium permanganates. Hydrogen peroxide and your potassium permanganates. You have your what? Hydrogen peroxide and your what? Potassium permanganates. Hydrogen peroxide and your what? Potassium permanganates. So here now, these ones that they are oxidized agent, they release nascent oxygen. And this nascent oxygen do what? Oxidizing the cellular components of these microorganisms. So 3% hydrogen peroxide, of course, you know that hydrogen peroxide is liquid in water. 3% hydrogen peroxide is used to clean wounds and remove debris. I'll talk about debris and matters from the wounds. So they are used to cleanse wounds and what? Remove what? Debris from the wounds. So for potassium permanganate, this one has a very broad activity. It has broad activity. We use a dilute concentration. Hope you people have done concentration because these things are put in 3%. These things are different concentration terms. So people have done concentration. You've done in your farm calc about percentage strength, ratio strength. When I say concentration, I mean strength. Percentage concentration or strength, ratio strength, and what is it called? Molar strength or mole strength. Have you done amount strength? Sorry, amount strength. Have you done this thing in your what? Farm calc? Have you? Because if you have not, this is not output, it may not make sense. Have you? You don't want to talk. Let's continue. If you have not, go and find out what it was. These are the things you should know. I can't be explaining it here because there's no time for that. This is another course and time, but it's okay. You will know about it so that go and just read up percentage strength, ratio strength, and amount strength. So this one, if I say 3%, I'm talking about what percentage strength. Let's assume that this thing I'm even explaining today, that this is 3% liquid in liquid. It can be 3% volume in volume, 3% weight in volume, depending on what is dissolved in the entire system. So if it's volume, that means the active ingredient or what is dissolved on this fast is 3 ml in 100 ml. That's what it means. 3 ml in 100 ml solution. 3% weight in volume. That is what was dissolved on this fast is solid. So it's 3 grams in 100 ml. That is 3% weight in volume. Yeah. So that's for the ratio strength. Yeah, but for potassium permanganate now, permanganate, that is solution 1 in 5,000 is used. This is a ratio strength. This is also another concentration term, ratio strength, 1 in 5,000. I would want to start going there so that I will not leave we are talking about AFNS, so that I will not leave what I'm saying. But I have some lectures on this, so you can go to my YouTube channel. I have some lectures on this concentration. You can watch it there. But if you are following up with my online classes, one day I'll treat it. But for now, let me not deviate because we have a lot of things to say. So just know that for potassium permanganate, the strength to use is 1 in 5,000. 1 in 5,000. But remember what I said before, that potassium, that some of these ideal these things should not be staining, at least unless there's nothing else you can do about it, you can use it. But this potassium permanganate are these strengths that are used for what? Mucosal what? Irrigation, but can stain and can also irritate. Yes, so that's what I want to make here. Then another class I want to talk about is the halogens. So here we have your what? Iodine, chlorine, and their derivative. Then iodophos. You have iodine, chlorine, and their what? Derivatives. Then we have iodophos. So these are under what? Halogens. They are what? Under what? Halogens. So what do? They oxidize and iodinate proteins. The other than what iodinate proteins of these what microorganisms. So they are effective even in the presence of fecal matter, especially iodine tincture. Especially iodine tincture. So this iodine tincture you'll be hearing about is under this class. Especially iodine what tincture. So in the presence of organic matters, they are also what effective, irrespective of whether there is organic matter. They are what effective. I've not seen why they use it to cleanse, remove, and agree that they will bring some of the debris, tissue debris. Now, so the tincture of iodine, you see, it's something like approximately 2% iodine with potassium iodide. Approximately 2% iodine with potassium iodide is a common skin antiseptic. Then chlorine is a powerful water disinfectant. You see, shall we see it now? Remember we are talking about disinfectants and what antiseptics. So I'm taking them together. So chlorine, iodine is good antiseptic. Chlorine is a very powerful water disinfectant. That's why they use it in water purification. Are you aware of that? Let's continue, please. And it's effective in approximately 0.1 to 0.25 parts per million. This is also another concentration term. Parts per million. ppm. I wouldn't go into that. Sorry, I have a lecture on that. Go to my YouTube channel and watch it. If I come across the link, I'll send the link to you. There are a lot of them. But for now, I just know that it's parts per million. Parts per million. Percent talks about, percent is actually parts per 100 in a way. But this one is parts per million. So we are talking about now. You didn't know here now it's million. Let me not go far. Let's continue, please. So we have effective at what? 0.1 to 0.25 parts per million for many pathogens. For many what? Pathogens. Yes, we know that chlorine is effective, but some microorganisms resist chlorine. Things like some acid-fast microorganisms, even spores resist what? Chlorine. Spore. Remember I told you that about spores. It's not just about the microorganism. What about the spores? So these are the points I want you to take note of. Then the fourth group I want us to look at is biguanides. Biguanides. Here we have something like chlorhexidine. So chlorhexidine, they are cationic antiseptics. They are cationic antiseptics. What do? They disrupt the cell membrane. They precipitate the intracellular contents of the cells. So they destroy the cell membrane and precipitate the intracellular contents of the cells. They are well tolerated. They have long residual activity, and they are affected by organic matter, but modestly anyway. Yeah, they are widely used for skin and wound cleansing. Unlike iodine tincture that is not affected by presence of organic matter at all, chlorhexidine modestly to some extent is affected by what? Organic matter. So what it means is that if you have iodine tincture and you have chlorhexidine, and there is need for you to choose the one for a wound that is filled with organic matter, depending on the nature of the wound, how long the wound has lasted, the one to choose. Now, let's continue. So for soaps, the next group is soaps, and I know that this lecture will not be long. Not how long the lecture is how effective. I don't believe in long lectures. Hit the point and throw your way. Now, let's look at soaps and detergents. Soaps and detergents. Soaps and what? Detergents. Soaps and detergents. So these ones are used mechanically to remove organisms, and are effective against many gram-positive organisms. They're effective against many gram-positive organisms. Here I'm talking about anionic soaps. Anionic soaps like sodium or potassium salts or fatty acid. Sodium and potassium salts or fatty acid. Sodium, potassium salts of what? Fatty acid. Sodium or potassium salts of what? Fatty acid. So these ones are effective mechanically. These are normal soap we use. Mechanically, they move organism and effective gram positive. Then we have under this now, we have quaternary ammonium compound. These ones are cationic surfactants. They also have germicidal properties. Yes. Now the next group is alcohol. This is where your isopropyl alcohol comes in and what have you. Isopropanol and ethanol. We have your words. So have you now seen the origin of this hand sanitizer that we are using when you have this COVID-19? This is the origin of it because it's alcohol self too, even though not all, but to some extent, to a great extent anyway. So alcohols here we have your what? Ethanol and isopropanol. We have their words. Ethanol. These are their words. Isopropanol. We have isopropyl alcohol. We have the isopropanol. So we have ethanol. This one is normal. We know this one. And we have our isopropanol. That is the isopropyl one. So this one denature proteins. They denature proteins. They lower surface tensions. They dehydrate cells. In fact, ethanol actually works best at 70% volume. Concentration term has come in again. Please make sure you know this concentration times, okay? 70% volume. What it means is that 70%, you know, the alcohol is readily soluble in water. So if you say 70% alcohol, we are talking about 70 ml of alcohol, of ethanol, sorry. 17 ml of ethanol. So them are alcohol, so alcohol is a general name. Specifically, ethanol is different, but they are under one alcohol. 70% ethanol means 17 ml of ethanol in 100 ml solution. What it means is that 17 ml of ethanol add some amount of water, so make the solution and make it up to 100 ml. So that's what we mean by 17 ml of ethanol in 17 ml solution. It's not 17 ml in 17 ml of water. It's 17 ml in 17 ml solution. So use the water to form this, make the solution and make it up to 100 ml. So the entire hydroalcoholic solution should be what? 100 ml. Why the volume of alcohol inside this one? 70 ml. So they are good skin antiseptics. So we cannot take it away from them. But they are very poor in sterilizing instruments. So they are very poor instrument sterilants. They are ineffective against spores, so they have no business with spores. They are ineffective against spores. What's that? I'm in class. They are ineffective against what? Spores. They are ineffective against spores. Note that too, very important. They irritate wounds. Yes, they are skin antiseptics, but they irritate wounds. So be careful. Don't go and start pouring alcohol in your wound. They irritate wounds. So they're not good for wounds. Even though people use it, alcohol, they are not good for wounds. Yes, but they are good antiseptic, but not good for wounds. They irritate wounds and they promote rusting. So note this point, okay? Good. Now let's look at the next group, aldehydes. Aldehyde, next class, aldehydes. Aldehydes. Under aldehyde, you see things like formaldehyde and glutaraldehyde. Formaldehyde, and what? Glutaraldehyde. Formaldehyde and what? Glutaraldehyde. That's what you see on that one, aldehydes. So these ones are potent protein denaturants. So they are very potent, active in denaturing what? Protein. And they are protoplasmic poison. Remember we talked about protoplasm at the beginning of this class. They are protoplasmic poisons. So they poison the protoplasm of the cell of the microorganism. Straight. So they don't waste time. Straight off. The one that is commercially available is formalin. The commercial name is what? Formalin. Formalin is actually 37% formaldehyde in water, often mixed with methanol. So we have formalin is commercial, but what it contains is 37% formaldehyde. Formalin is what? 37% formaldehyde in methanol water mixture. In methanol water mixture. Methanol water mixture. At 7% formaldehyde. But you can have aqueous formaldehyde anyway. Aqueous formaldehyde has about 3 to 10% of formaldehyde in the entire solution. So we call it aqueous because the aqueous phase is more. Is more as against 37% you see in formalin. Of course, you know what they use formalin to do now, to preserve what? To preserve what? Okay, I will not tell you what they use formalin to do. I'm listening. This one is popular now. It is not pharmacology again, it's commercial.
It's for preservation.
Yeah, good. So that one is there. Be specific. Where do they use it? Where do they use it? You know, certain now as a healthcare.
Mugs.
Where do they use it more?
Mugs.
Mugs, right?
Yes.
Good, good. Please explain that mugs for those that did not hear you well. Explain what
mortuary.
To do what in mortuary?
To preserve corpses.
Thank you. Because there are some women here that may not even understand what they are saying. I'm sorry, but it's true.
Dead bodies.
God bless you. I know what I'm saying. I know what I'm saying. All right, let's continue. So, have you now seen why it's used? It's a potent protein denaturant, and it's poisoning the protoplasm of these microorganisms. So it's very effective. But we have the aqueous own at just about 3 to 10%. Formalin is 37%, is high concentration. So we have the aqueous own that is just 3%. That is 3 ml, 3 to 10%, 3 ml in 100 now. It's dilute. It's actually diluted form of it. So we have aqueous formaldehyde and the glutaraldehyde. These ones are very good, very effective sterilants. They are good to sterilize instruments. They are used to sterilize instruments like endoscopes and other equipment. So they are very good at that. Is that clear? Now, but glutaraldehyde is less pungent and irritating than formaldehyde. Glutaraldehyde is less pungent and irritating than what? Formaldehyde. So this will now inform you the one to use depending on what you want to achieve. Is that clear? Now, let's go to the next class. Next class, we have the acids. We call them just acids. They are going to run them out acids. Under acids, we have our boric acid and our acetic acid. We have boric acid and what? Acetic acid. Boric acid and acetic acid. Boric acid and what? Acetic acid. So this one, they are side down. To some extent, they can be what? Static. So what happened here now? This one now, what do they do? Because they are acid. Remember acid. Acid has a lot to do with the releasing of proton, which is hydrogen ion. Proton, hydrogen ion. This one, they release hydrogen ion. So this hydrogen ion that causes the harm. So they release hydrogen ion. Now, we have strong. Hey, who is this person coming to our lecture by now? Who is this human being? Let me see the person's name. Who is this human being entering our class by this time? Aderonke. Aderonke. By this time, you're entering our class. Aderonke, the latecomer. This time, you're entering our class. Oh, wow. Wow. Please, let's continue. So, inorganic acids, strong inorganic acids are very corrosive. So that's why their use is limited. They are limited in use. Strong inorganic acids are very corrosive. So most of the things we are using are either organic or weak ones. So we have things like boric acid now. Boric acid now. Boric acid at the concentration of 2 to 4%. Something that is 2 to 4% is highly aqueous anyway. Boric acid at 2 to 4% is a mild eye or mouth antiseptics. So for eye and mouth antiseptics, boric acid at 2 to 4% is used. Concentration is used. Then, if you come to acetic acid, the concentration may differ depending on what you want to achieve anyway. But in general, they are used to do what? Cleanse wounds. They are also used for what? Urinary irrigation. And they are also used in treatment of what? Otitis media and some other topical what? Preparations and applications. Is that clear? So please, in as much as you are doing this, note that it's not good to systemic absorption of what? Boric acid is toxic. It can be toxic. So it's not for systemic what? Use. Is that clear? It's for local use. So these are the points I want you to note under acids. Now let's go to the next class. We have the dyes. This lecture is almost over. We have the dyes. Dyes. Under these dyes, that's where you start seeing your gentian violet, all those dyes you use. Your gentian what? Violet. You see things like acryflavine, many of them, proflavine, scarlet red, many of them, brilliant pink, many of them. These things are antiseptics. And please note this point, they are especially active against gram-positive organisms. Now, single out gentian violet. Gentian violet and another actinic dyes, they are used in wound cleansing and topical creams. So these are points I want you to note here. I think second year practical BDP 231, gentian violet is one of the preparation then. Yes. We just finished the practical last week said. It's one of the preparations. Please find a way to link whatever you are doing in AUM with whatever you are doing in BDP. It's the same thing. All these things you see BDP, they are just for easy coverage, but they are talking about the same thing. In BDP, you are preparing these things. In AUM, it's telling you how to use them and what to use them for. They are the same thing. Is that clear? Good. Now, the next one is nitrofurans. The nitrofuran derivative or simply nitrofurans. Nitrofuran derivative. Nitrofuran derivatives. Nitrofuran derivatives. The example I want to do is nitrofurazone. Nitrofurazone. So this one is bactericidal. They are bactericidal topical agents. This one are effective against both gram-positive and gram-negative bacteria. Okay, so they are bactericidal, effective against gram-positive and gram-negative. At concentration of 0.2%, please. Hope you're noting these percentages. At concentration of 0.2%. Topical cream anyway, topical cream. as topical creams. They are used for burns and skin infections. They are used for what? Burns and what? Skin infections. And they act thereby inhibiting bacterial carbohydrates metabolizing enzymes. So if these enzymes that take care of metabolism, metabolism in this bacteria is affected, it will disrupt a lot of things in this body of the organism. Of course, if nutrient comes in, and nutrient is what comes with the nutrient is not utilized, the cell will die because the cell needs energy. The cell needs energy. Of course, the cell undergo respiration. You see how importance of this carbohydrate metabolism in this microorganism. The cell needs the carbohydrates for nutrients to be able to carry out respiration in the cell. So if this metabolism, this carbohydrates is affected, these enzymes are affected, there will no the carbohydrate metabolism will be disrupted in the organism. Definitely the cell will die. So that's why they are what? They what? Bactericidal. That's why they are what? Bactericidal. So we've come to the end of this class. What is remaining for this course is our presentation, which you have already seen the schedule. On daily basis, I'll be posting the schedules for the what? Presentation. On your chosen day, you come, the link will be sent on the group. You click on it, just as you click the link and enter this lecture now. You click on the link and enter and do your presentation. Please read everything, every instruction. There are a lot of students I am handling. So if you miss any of the instruction I already posted, I won't even have time to talk to you. I'll just skip your own and be going because no time to waste. So please, if I skip your own, go back to the instruction. There's something you did not do well. Please note that. Please note that. Some of you, I say 3 days, you are sending me tomorrow. I don't have time to start talking because I have a lot of people to reply. So once you don't meet up, I will skip you and keep going. So if you are skipped, go back and check the instructions I have been posting. And after each update, I'll post the instruction. Go back and see what you're not doing right and do the right thing. Remember, this whole thing end under 1 month. This whole thing end under 1 month. So ensure you fix your time. I've sacrificed my Christmas to be sure that people, even if you fix date on 25th, I will attend to you. So that you know that within this 1 month before your exam, you all must have done your what? Presentation. All right, so this is where we end this class. Is there any question? Any question? During this class, I pointed out some that are strictly disinfectant and some that are strictly antiseptics. So I want you to go do more research on all those ones I listed. Then get more. Tell me the one that are strictly antiseptics and the one that are strictly disinfectant. Ensure you do that. Is that clear?
Yes, sir.
Any question? Any question? Silence means that there is no question. So let me not waste your data and my data. So we end this class here. So as I promised, I will send you more review questions so you can use to practice. Read your course material, read textbooks. I hope you all are in my Telegram channel. There are a lot of material you need to lay your hand on so that you get prepared. I don't train handout students. I train people that read widely so you can be confident and know what you are doing, not people that will just go and read one handout and if they come out, they can't even solve any problem because they are handout pharmaceutical technicians. No, I don't train such people. So you must learn how to read textbooks. I have been saying it from the beginning. So, and that's why I created all those channels, so you can have access to any textbook of your choice. So you can read these topics and get grounded. All right, thank you very much. God bless you. See you next time.
Thank you, sir.
Thank you, sir.